The United States has reached a grim milestone in the number of daily deaths from COVID.
The total number of reported deaths tallied on Wednesday was more than 2,800, the highest number since the pandemic began. Dr. Frank McGeorge joins us with the situation here in Southeast Michigan and the reasons the current situation is expected to worsen. Doc?
Yeah, Kim and Devin. So in terms of deaths here in Michigan, the daily numbers have been steadily increasing since October. But what's different now compared to the spring is that back then we were one of the national hotspots, particularly here in Southeast Michigan. Now, the nationwide increase is being fueled by much more widespread infections. But of course, that does not mean we are not at risk. Data released by the state shows that the death rate per million in the Detroit region was 5.8 on November 25th, lower than the statewide death rate of 8 per million. Unfortunately, the state's data also shows hospitalizations have increased more sharply in Southeast Michigan than other parts of the state. In particular, Region 2 North, Oakland, Macomb, and St. Clair counties have seen a greater increase in patients admitted to the ICU compared to other parts of the state. A greater number of sick or hospitalized patients will likely translate into more deaths in our region as some people lose their battle with COVID-19. Now, looking at the statewide hospitalization data, we are now at 90% of our peak in the spring. This time, though, hospitalizations are spread out across the entire state, not concentrated primarily in our region. But it doesn't bode well. Increased statewide hospitalizations will also likely translate into more deaths. Looking ahead, although most recently there has been a slight drop in new cases, with recent Thanksgiving travel and gatherings and upcoming holiday gatherings, it's expected that cases will surge. Without a consistent change in behaviors by everyone, infections will continue, and further governmental restrictions are likely to be put in place. Now, so far, hospitals have not altered their operations. We are still performing elective surgeries and other treatments. People are still being admitted with medical problems other than COVID. Hospital capacity in Michigan still exists, but we will burn through that capacity at the current pace, given especially that patients admitted to the ICU with COVID often have prolonged stays.
Yeah, well, Frank, should we read anything into the decline in the new cases that we've had over the past few days?
Well, you know, Kim, as we've seen in the past, these periods of decline can reverse very quickly, and we're not really quite far enough out from the Thanksgiving holiday to fully see the effect that increased gathering and travel might have had. I hope that the decline continues, but everyone needs to really bear in mind that widespread protection from a vaccine, well, that is months away, and there are still many months of winter to get through. So any decline that we do see will probably be short-lived without everyone doing their part to stop the spread.
Yeah. Okay, Frank, we appreciate it.